Hello, and welcome to Decommissioned, the serialization podcast, where we decode the complexities of global serialization one scan at a time. I'm Justin Adden, and I'm joined by my co-hosts, two seasoned minds who've both handled, tracked, and traced more barcodes than most could scan in 100 lifetimes. Jerome Bertan and Scott Pugh. Gentlemen, would you be so kind as to introduce yourselves?
Hello, my name's Jerome Burton. I'm the former General Manager of SecureMed UK, the UK National Medicines Verification Organisation, or NMVO. I worked with SecureMed from the beginning of 2017 to the end of March 2025. I set up, I built, I led, and I operated and transitioned the business all the way from the inception in 2017 through the go-live of FMD in 9th of January 2019, and then for 5.5 years, and 5 years until it ended at the end of last year, when the Windsor Framework for Northern Ireland withdrew FMD from the United Kingdom. I then closed down SecureMed UK.
Yeah, hi everyone. Scott Pugh, principal of Jennison LLC. We're a advisory consulting firm based in the United States. Background about myself: I have 17 years in the pharma serialization space, mostly on the consulting side. Also have experience on the solution provider side as well. So I generally support across different segments, manufacturers, wholesalers, from a serialization planning and strategy perspective through implementations, obviously support with various global regulations, as well as then ongoing support, focusing on process improvement and technology improvement as well. So I look forward to I'm sure, many very interesting discussions that we'll be able to have on this podcast. Thank you, Justin.
Thank you, Scott, and thank you, Jerome. So, throughout this podcast, we'll be unpacking the full spectrum of serialization, cutting through the noise and focusing on what actually matters. Whether you are new to serialization or you have been navigating serialization for years, our goal is to surface practical insights, challenge assumptions, and spotlight what it takes to build strong, scalable capabilities. In this first episode, we're taking stock of where things stand globally. 6 years into the EU FMD and a major DSCSA milestone in the US. We will discuss what's wrong, what's working, what's right, what's not, and what should the industry be thinking about right now. Scott, let me start with you. How would you characterize the current state of serialization?
Yeah, absolutely. And I'll just quickly say again, that I look forward to discussions, and I think what'll be interesting is we'll obviously cover some broad topics in this first episode today, but I'm sure throughout the discussions that we have over the next 30 minutes or so, that we'll certainly touch on areas that I know we'll look to dive, much deeper into in future episodes. Getting deeper into, I think, key considerations like technology and solutions, the role of standards, all of those really critical topics that ultimately drives, how a company is able to build out their capabilities for serialization compliance. So I think, coming back to your first question, Justin, when we really look at the global serialization landscape, this is a pretty interesting time. I think really looking back across its history, we've certainly had many countries, many regulations that have gone into effect, going back all the way to, 2010, 2011 kind of time frame with some of the earliest adopters, through to then obviously FMD and DSCSA on somewhat similar timelines, at least from a regulatory perspective, obviously very different timelines from an implementation perspective. And the reason I think it's an interesting time for companies in the industry and those that are working in the serialization space is really because with I'd say the upcoming milestones, as you mentioned, for DSCSA specifically, you're going to have within 30 to 60 days essentially, you could arguably say two of the largest markets in the world, being US and EU, be under what is supposed to be, let's call full serialization enforcement, obviously with many unique differences, and I know that's what we'll dive into in greater detail in terms of those differences between the two regulations. But I think it's going to be a really interesting time from a US perspective because it'll really be the first time I think that there's the almost certainty, right? Assuming there is a level of enforcement that we all expect to be there, that you're going to see how the ability to comply with DSCSA really can impact a business, right? From a purely and directly commercial standpoint, right? That's not something that the U.S. has really had to experience over the 10 plus years since DSCSA was first passed, right? We've certainly had these interim milestones along the way. And we certainly had some very critical milestones, right? The milestone to ensure every unit is serialized, as an example, being certainly one of the most critical. But now we're getting to that point finally, after many delays over the past year and a half, where if you're not compliant from a data standpoint, in terms of DSCSA requirements, you run the very real risk and the very real likelihood that your product is going to be disrupted. And so I think with that mindset, and I know that's what obviously many in the industry are focusing on, especially those that have, distribution within the United States. I think, again, that's why this is a really interesting time for companies to obviously to have to keep their attention on the near-term goals, making sure they're compliant, making sure that they're evaluating and monitoring the impact that it does have on their business, but also use it as a time of reflection, and look at some of these other regulations that have been out there for quite some time and have been in full effect for quite some time, and see what kind of learnings, and takeaways and best practices that we can take from those other regulations. So that's really what's going to be, again, interesting, I think, for the U.S. regulation over the next couple of months. And I think with that, we can even start the discussion around, looking back at one of those certainly main regulations that has been in place, that being FMD. And we'll probably just start to have some conversations about what has worked well from an FMD standpoint, what are potentially some things that could be taken away in terms of best practices from FMD that maybe companies will start to look to apply as we proceed ahead here from a DSCSA standpoint. So I'm not sure, Jerome, if you kind of have any thoughts or comments just around from historically what has worked well and maybe what hasn't worked well from an FMD perspective.
Yeah, thank you, Scott. I guess perhaps we should go back first to what is about the purpose of FMD. And the purpose of FMD, Falsified Medicines Directive, is to provide a point of delivery verification system which enables the supply chain to identify where they occur, the entry points of fake medicines, and for regulators to be able to take action to close those down. And this only works, obviously, if everyone knows what their role is, plays their part, has the required people, and we have the required data in the system. Well, the European Medicines Verification System comprises of 28 countries with a national system in each country and a central hub through which manufacturers, generic manufacturers, research-based manufacturers, and parallel distributors load the serialized packed data into the system. It's remarkably robust. It's been working since the 9th of February 2019. It works day in, day out, 24 hours a day, and whilst there have been some unplanned outages, few and far between, they've been very few and far between. And as I said, it's a big system. It's 28 countries. It deals with about 12 billion packs of medicines a year. There are about 110,000 community pharmacies, 4,000 wholesalers, 7,000 healthcare institutions, 2,500 marketing authorization holders, and about 2,500 software providers. It works remarkably well and continually improves on an annual basis through a controlled change and release process. It's an interoperable system which works very well with multi-market packs. Those are where multiple countries share packs that can be sold in those markets, as well as in what are called intermarket transactions, where packs are sold from one country to another, and when they're actually checked out in the system by a pharmacy, It'll go and the system will actually, through its interoperability, will actually make sure that those transactions are performed in the country from which those packs came from. The target, one of the key elements of FMD is actually scanning and dispensing medicines, verifying them as they go through the supply chain, ultimately arriving at a pharmacy which dispenses those to patients through a process we call decommissioning. Now, obviously, when the decommission of a medicine pack goes well, then that's fine. The medicine's handed to the patient. But when it doesn't go well, there are alerts and exceptions raised. And the target on alert reduction that most countries in FMD have performed brings the focus to protecting the supply chain. Analysing those alerts and identifying which ones could be potential falsifications is the key. It's people keeping a watch in every single country to make sure that the supply chain is kept safe. The use of digital twins of medicine packs, which is what FMD provides, has achieved its objective when integrated with the audit trail data that's built up. It makes a powerful tool to help the national competent authorities, NCAs, close down the entry points for fake medicines in the supply chain. And that digital twin medicine pack concept is also starting to enable wider use cases to be considered. I should also highlight the EMVS community. There are centres of excellence in each national medicine verification organisation in each country within the EU FMD and within EMVO, the central organisation that operates the hub, which actually collectively provide a very valuable asset in targeting fake medicines, but also in the wider capability of national healthcare systems. So that's the good things about what's happened with FMD. Where are we falling short, perhaps, and why? The FMD model requires, as I said before, every stakeholder to play their part. The system must work, the data must be in the system, and the data must be of good quality, and all actors must be playing their parts in that system. Not all end users, even now, in all countries, are connected to the systems. Most countries, though, are over 95% of users connected. Verifying whether the users are using the system is also a challenge. Enforcement is key, but the national competent authority resources to do that are limited. In some countries, the wholesaler model doesn't work well where pharmacy automation is used, as some of the high-end automation is too fast for the FMD systems. So, for example, it can cause issues as every pack needs to be scanned prior to going into a tote box. There is the 10-day rule on undoing decommissions, which is seen as very tight by community pharmacies. Pharmacies not scanning or scanning inconsistently, double scanning, or not fully understanding the consequences of some actions in the scanning process also causes a lot of alerts and exceptions within the system, as can the software providers who provide software solutions to pharmacies, to wholesalers, to hospitals and other healthcare institutions. If those software systems aren't set up correctly or when they're upgraded, they can cause large amounts of alerts if they're not managed carefully. There's also fragmentation of the NCA function in countries and inconsistent or under-resourced enforcement, as I've stated already, allowing those that don't want to comply just to not do so, thereby increasing the risk that falsifications will get through the system. Differences in the way the NCAs work and the way that medicine supply operates across EMVS countries also increases variability in the way FMD operates.
A lot of great points there I thought were really interesting, especially around user adoption, scale, and the lessons we continue to learn across the EU. One topic you raised, though, early on, Jerome, really stood out to me, and that's integration and interoperability. Scott, I think that's probably a good place to bring you in, especially from the US perspective. How is that playing out under DSCSA?
Yeah, well, certainly, and I think that is definitely one of the key points. If we use that overview that Jerome provided, right, and start to take some of the key characteristics of how FMD was approached versus how DSCSA was approached. I mean, there are some very clear differences, right? And I think the most important ones to highlight FMD first and foremost is going to usually be referred to as a verification model, a serialize and authenticate model, right? You have responsibility at the front end of the supply chain through manufacturers to upload data, and then you have responsibility, and not to say that you don't have responsibilities in between, but I think the primary responsibilities, if you will, sorry, one second. The primary responsibilities to kind of ensure that the overall system functions, right, is really heavily focused on the start of the supply chain and then the end of the supply chain, right, which is a very different model from the US DSCSA approach, which is usually referred to as kind of a true track and trace model, right? We don't have that concept of any sort of centralized system or any kind of even semi-centralized architecture like you see through the EMVS system and the corresponding national market systems throughout Europe. And I think one of the immediate takeaways is that, my perspective, and certainly would love to hear your thoughts, Jerome, but when we think about how FMD was able to go live, right? FMD set a date, and it was a single date where, short of course, a stabilization period, let's call it, that was carried out in various markets for a period of time after that initial go live date in 2019. The regulation went live, on that date. And I think that's really interesting to look at because you can contrast that against the DSCSA perspective, which has been 10 years plus now, right, of implementation deadlines. And even more interesting, and I think even more important to focus on, is we are in the midst, as we speak, of a nearly year and a half delay from when the final milestone of DSCSA was supposed to go into effect. And I think it's very easy to say, right, that probably a large part of the need for the lengthy sort of go live milestone and phased approach of DSCSA versus the sort of singular go live date of FMD is definitely due to the differences of the architecture, right, and the modes of the regulations themselves, right, the serialized and authenticated FMD versus the track and trace model of the USA of the DSCSA. But to Justin's point, I think the other big and interesting factor there that again, from at least my perspective, would seem to have contributed to the ability for FMD to sort of go live at that single point in time is, like Justin said, is the data requirements for FMD are very explicitly defined, right? Manufacturers know exactly how they need to send data, where they need to send data to. Dispensers, end users know exactly the types of data integrations that they need to have with the national systems. Even the exception handling concept of FMD, right, is very explicit through the concept of FMD alerts. We don't have that, on the US side. And I think that's a very big reason, and one of the big reasons why we've now sort of suffered through many, many delays, because we have much more of a responsibility for the industry itself to effectively decide for, on their own, here's how we want interoperability to work. Right. We have, thankfully, the concept of standards such as EPCIS from the GS1 organization, and that certainly is very widely used across DSCSA implementations. But I think we can also say that's probably one of the core challenges that the industry has had as a whole, right, is sort of proper use and sort of strict adherence to those EPCIS standards. Again, I think a very large contributor to the delays we've seen. So I think that's an immediate kind of interesting contrast that I see between FMD and DSCSA, was just the ability for FMD to go live, such a ambitious, undertaking that was achieved. And as you said, Jerome, has been working quite well since its go live time. That's going to be, again, very interesting to see how this plays out on the US side, because like I said, we're really just getting to that point that I would consider to be probably the most equivalent milestone to the FMD go live, right? I mean, you can argue this upcoming deadline in August for DSCSA is probably the most equivalent go live that we've seen in the history of DSCSA to what FMD was able to accomplish at its go live time. So again, very interesting to just keep monitoring, how the industry performs over the next few months.
Yeah, I think that is. I think that is interesting. And now the go live of FMD was effectively a big bang for all countries that were in scope at that time. Obviously, Italy and Greece have only just joined the EMVS system now in 2025, and I think Italy's going to take about a year or even 18 months to really get going. I think Greece is up and running now. The system when it started, no, there wasn't actually much data in the system when it started, and also none of the users were really knew quite what they were, the end users, how they were supposed to operate and how they were supposed to interact with the system. And there was quite a lot of work that needed to be done up front to get everyone ready and to get everyone connected to the system. But once they were connected, there was also quite a lot of people actually learning how to operate within this interoperable system under FMD, and there were many different parts of the supply chain. One of the key things of FMD was it actually connected the whole supply chain from manufacturers through obviously the medicines verification organizations to hospitals, to wholesaler distributors, to, in our case, health centers and general practitioners, and also community pharmacy. And by connecting the whole supply chain together, it created many other issues about how medicines are managed and how the systems work and interact with each other. And that took a long time to get stabilized. And many countries, because the countries operate in different ways, many countries started with what they called a soft launch period. And some of them didn't actually end their soft launch period until last year, until 2024. So it took them 5 years really to get through that soft launch period and get themselves into a position where everyone had used the system enough, knew all the ins and outs, knew how to make it work, and knew how to optimize it to really get the benefits out of it.
Yeah, and I think that soft launch concept is interesting as well, right? Because that probably correlates the closest to what we've been going through in the US in terms of these multiple sort of stabilization. Well, I'll say a
Mhm.
stabilization period followed on by, a further delay, call it what, whatever language you want to use. But I think the parallels and something that you also mentioned earlier, Jerome, right, is FMD also struggles with just having proper resource for enforcement, right? So I mean, there's no guarantee, as you said, right? There can still be end users in certain markets that may not even be standing or may not even be connected, up to national systems to sort of be following what they certainly are supposed to be doing at that point. And that's I think, a very real question on the DSCSA side as well, right? And again, directly in focus for these upcoming months, because as soon as technically, if I'm a manufacturer in the US, I've already crossed my milestone, right? I am under full DSCSA enforcement as of today. Yet I think what's interesting, right, is since that deadline went in end of May, you've not really seen, I'd say, any level of action to be taken, be it from an FDA standpoint, or really what's probably going to be more of the enforcement arm, if you will, is going to be the industry itself, right? And even more specifically, largely the wholesalers within the US have certainly always been at the forefront of effectively enforcing DSCSA. And that segment has very clearly put their focus on this upcoming August deadline as sort of their deadline for enforcement. So manufacturers have kind of had, another few month period here to kind of continue to get ready. But now once we cross that end of August deadline, that question is going to come front and center again of, okay, now what type of actual enforcement are we seeing, right? Are we going to see the wholesalers truly start to not just quarantine, but reject shipments or return shipments in short order if data, can't be supplied to them as they, in some ways you could say as they are supposed to already be doing, but again, probably really aren't, but certainly have stated their intentions to start to do so come August, and that's what all brings it back to that central point of this is really now the first time, based on the industry's enforcement of DSCSA, that we are likely to see, significant disruption to product supply if DSCSA compliance is not met. So that seems to be a clear kind of common theme, I think, across both regulations, right? Is it ultimately all comes down to enforcement. Somebody has to actually be watching and checking to make sure that this is all happening. You can hope that the industry does that themselves to a degree, but there also is the expectation and I think assumption that there will be other entities, be it the FDA, state agencies, that are going to really have to be part of the enforcement as well, if you want to truly gain the benefits of what DSCSA or any serialization regulation is supposed to deliver, right? Which is further protecting the supply chain, right? You need people to actually be ensuring that it's being followed in order to get those benefits, out of the intended regulation.
Yeah, I think I'd agree there, but I think there's two things there. One is about the enforcement, but if you think about it from the point of view of a pharmacy who's actually issuing medicines to patients, they obviously need to receive the different medications from their different distributors, but they also need to provide continuity of supply of those medicines to their patients. And obviously, in Europe, we all had this across the world. We had the pandemic during 2020, 2021, and into 2022, and there was the priority from the NCOs, particularly in Europe, to ensuring that patients actually were able to receive medicines at that point in time, rather than trying to quarantine them. And there was a big risk when you first start off, particularly with a lot of errors in the way people work, the way the IT systems work, the digital systems work, and the way just the interoperable procedures work, that you could end up with very large amounts of false positive alerts and exceptions within the system, which could end up with pharmacies with very big piles of quarantine packs. And I think no one really wanted that right at the start, which is the reason why a lot of lengthy soft launch periods were implemented to make sure everyone really bedded down the system and got the procedures working, ironed out the glitches within the way that the systems worked, and making sure that the data was clean in order that the system would work. So then you could then start to implement the quarantining of packs. So when a pack does raise an alert and you got the alert and exception levels down to a low level, you're not going to end up with huge stockpiles of quarantine medicines and disrupting the supply of medicines to patients.
Yeah, that's I mean, exactly another fascinating parallel, I think, to what we'll be able to watch and monitor on the US side, just like you said, because there has been a very clear position, both from the industry and the FDA on the US side, that has said that they are not impacting product supply, just full stop. But
Mhm.
eventually, these two worlds have to come together, right? Meaning you either have to kind of say we're going full ahead with DSCSA enforcement, no matter what what the outcome of that is or what sort of disruption that causes, or you
Mhm.
have to say, look, we tried to go ahead with full enforcement, but it caused too much product disruption. Therefore, we need to, whatever it may be, pause further. Whatever actions have to be taken. And so I think, again, just another fascinating parallel that we're going to monitor on the US side to see, right, if there is that level of product disruption caused because of not, some type of enforcement to DSCSA, would some type of authority step up to, further take action to effectively choose product supply over DSCSA enforcement, right? And which again, I think comes back to one of the earlier points. Like I said, to me, this August milestone is probably the most direct correlation to what would have been the FMD go live in 2019. The
Yeah.
the difference though is that this August deadline, as I had said, is already a year and a half delayed from when the original deadline was. So whereas FMD, had its deadline and then had kind of its stabilization period after it, we were already supposed to have been going through that stabilization period for the last year and a half. So again, it's fascinating to see what will happen, post end of August, whether there's sort of an accepted continuance of a stabilization period, or again, whether there truly is going to be strict enforcement of the regulation. It's just going to be interesting to see.
I think the learning that we would have from FMD is that I think you'll see that very strict enforcement will take a while to come through. Obviously, in one of the challenges, one of the advantages you have in the USA is you have a single country. One of the perhaps the advantage, you can go either an advantage or a disadvantage in Europe, is that we have 27 or 28 countries. And each country obviously has a different NCA, and they have a different way that their medicine supply works. And so therefore the national competent authorities work in different ways and they enforce in different manners, which also creates inconsistency within the system. And that is a difference. I think also, as I understand it, when alerts and exceptions are raised within DSCSA that could be a potential falsification, it is the manufacturer that has the responsibility for retrieving the information about the audit trail from the supply chain. Whereas in EU FMD, the National Competent Authority will go to the NMVO and ask them to provide the information that will enable them to do their investigation. And so it's a slightly different model. And the audit trail that's built up in a point of delivery verification system is something that is readily available and is a very powerful tool to support the NCA in the work that they do. And I do wonder how challenging that process is going to be for manufacturers in the USA once the FDA starts enforcing that.
Yeah, and I think playing off a lot of the key points we've raised, maybe to switch gears a little bit and kind of pose this as a question, because I certainly want to make sure we also bring it back to, if I were to put myself in the shoes of, let's say, and I'll pick a very specific use case. If I let's say I'm, somebody responsible for serialization at a, a at the time a pre-commercial manufacturer. So somebody who's going to be launching their first product, right? So at this point, they don't yet have any serialization capabilities in place. They have a target, let's say sometime in the next 1 to 2 years of an estimated first product launch. And therefore, they're starting their journey to build up their serialization capabilities. I've worked with a lot of manufacturers who have been in this exact position, let's say over the last 6 to 12 months. And, certainly depending on what their launch timeframes are, that's going to be the first thing that drives anything. But one of the first, I think, recommendations I make when it's allowable, when it's feasible, is I say, hey guys, you probably should think about maybe just pausing for a period of time, if you can, until the industry works its way now through this upcoming August deadline. Because, and the reason for that is simply because what the industry is likely to learn about its ability to comply and just sort of operate in a fully enforced model, that learning, the bulk of that learning is really going to only happen over the next 30, 60, 90 days, if you will, right? And again, that assumes that there is sort of a strict level of enforcement that we see come in place post August. And so one of the immediate recommendations that I'll tell folks is, before you get too far down the path of starting to do all of your planning, building out all of your capabilities, identifying solutions, things to that level, if you have the luxury of time, probably wait and see how this all plays out. Maybe till, we're into Q4 of this year, later, kind of towards the end of this year, see how it's shaken out across the industry, and then start to make your decisions about building capabilities, based off what you're seeing at that time. Because I think there's a very good chance that what the industry learns and sort of the understanding and sort of perspectives of best practices, approaches, capabilities could be very different, 90 days from now versus what it's been today. And I think historically up to that point, so I think that's just an interesting perspective for, again, at least for somebody that would have that responsibility from a DSCSA standpoint. And I'm not sure, Jerome, again, it's different on the FMD side, obviously, because the regulation has been in place. I'd say probably most of the capabilities are fairly well established. Probably still some learnings and growings and changes that are happening specifically on the alert management side. But I don't know if you would have any sort of key recommendations or suggestions, again, if it was a manufacturer that was maybe just starting their journey for FMD compliance, and certain best practices or recommendations that you would have for them.
Well, I think in FMD we went for everyone connected and everyone up and running and scanning from the 9th of February. And obviously not everyone was connected at that point in time. There was a lot of data loading going on. The first thing we got was I would say, millions upon millions, in some cases tens of millions, of alerts coming out of the system. When everyone is properly connected to the system, you have to make sure everything's configured. Your data is really, really important to making sure the data that every player has got in the supply chain is of high quality is really, really important. But also at the other end, at the user end, it's really important that those systems that are connecting in, the pharmacy systems that are connecting, that these scanners and things are connected to, that those systems work correctly and they create the right inputs and the right outputs. And one of the inputs obviously is the scanner itself, and those scanners have to be properly configured to read the 2D matrix, and the software that goes with them has to be able to recognize all the different forms of a 2D matrix and all the different ways round that the serialization data can be presented. So under EUFMD, the serialization data that's printed on the pack can be in any order, and that was one of the key things that some of the software suppliers found quite difficult in the early stage. So you will get a lot of disruption caused by the software systems and the scanners not being at the end user end, not being properly configured at the start of it. And I don't know in the USA whether that's actually, you've had 10 years, whether that's actually been played out and that works very well. But certainly we found that to be a big problem at the start. We also really didn't have a standard way of looking at alerts and exceptions right at the start of FMD. And the industry came together, and in fact, the whole community within EMVS and European industry came together to form a common best practice guide to alert and exception management. And that then led into the development of the European Alert Management AMS hub and the national alert management systems that are now used. It was perhaps a little bit of an oversight that wasn't built into the national systems and into the end user supplier systems right at the start. But I think that was one of the big learnings we had. People just didn't realize at the start how many alerts and exceptions there were going to be and how difficult it was going to be to get the whole system stabilized.
Yeah, and I know for sure alert management is a singular topic that I know we'll dive much deeper into in future episodes as well, because as you said, that's probably the area that has kind of the most change ongoing, if you will, right? And
Mm.
therefore has probably the most potential to impact current capabilities, as well as, again, certainly those that are just building up their capabilities for the first time. Um, I think another, again, sort of playing off this theme of, if I was just starting out in serialization and I need to build my capabilities, what are some key things to watch for? I think what another interesting perspective, but in a different way, is right. If I'm somebody who has now had my capabilities established for some length of time, and especially right because there are obviously many companies out there that will have to comply with both US DSCSA and FMD, right? Given they'll do distribution into both of those markets, as well as potentially right many other markets around the world. And I think one of the interesting maybe changes that I've seen over the recent years versus I think what was the initial approach and assumption is clearly what companies that are needing to comply with multiple global serialization regulations. Of course, in a perfect world, they're looking to go out and essentially build one common capability, if you will, hopefully focused on let's say one sort of core serialization system that is able to comply with all of the global regulations that they need to comply with, right? And you certainly see lots of companies able to achieve that model and certainly carry out that model. I think what's interesting though is more recently, I seem to come across more companies, I'd say of all sizes, right? From even very small organizations that are still, distributing into multiple markets, all the way up to larger organizations as well, who are very much open to the possibility and even the potential need to not just have one serialization system that can cover all regulations, right? But rather potentially have multiple systems, one that might focus on FMD, one that might focus on DSCSA, and the only, I guess, kind of core takeaway that I can deduce from that is because that's purely based off experience that those companies are having. Because again, if anybody were able to choose their perfect situation, everybody would choose to just have one system and one core capability that can cover all global regulations. I don't think there's any debate about that. But the fact, I think that you see companies who are open to the possibility that, yeah, I might need to have a system for EU. It might be a different system for DSCSA, right? Is it at least reflecting, I think, in a positive way, the understanding that, at the end of the day, these companies and these entities across the supply chain need to ensure they have the best capabilities for a particular regulation. That might not always be the same system in every case, right? And so again, I just think that's an interesting dynamic for those who maybe have established capabilities, and especially again as we kind of come up on these upcoming milestones for DSCSA, which are really starting, I think, to kind of put the stress, and I'll say maybe in a different way, stress test a lot of serialization systems and capabilities in ways that they never were sort of stress tested before. And it's also therefore making companies realize, hey, look, this system, it might be doing the job for me and for FMD compliance, and that's all well and good, and we can keep that moving. But hey, it's just not meeting our needs from a DSCSA standpoint. And so we have to at least be open to that possibility that we might just need to have different systems, different capabilities to meet DSCSA requirements as well. So again, I think it's even for those that, like I said, have established capabilities. That's it's I've yet to really see probably a lot of organizations that were able to put in systems years ago at this point and fully be running smooth with absolutely no issues somewhere, right? Whether it be on the FMD side, whether it be on the DSCS side, or with other global regulations, right? I get the sense that the industry is recognizing, right? We have to have some flexibility because we need potentially different capabilities for these different regulations.
Yeah, and I think if you think about it from the size and scale of the manufacturer, particularly manufacturers, if you take a big manufacturer like Pfizer, they have a lot of they're a big organization, or Amgen, the big organizations. They've got a lot of capability and a lot of capability in different countries, and they can set up different functions or similar functions on the serialization to serve the different markets. But if you're a medium or a smaller type company, having that level of scale isn't really possible. And that's where you've got to find some common ground and find common ways of working and actually working that through. And I think it's really important when you look at this now, look in Europe, there are 2,500 marketing authorization holders. I know that ENVO talks about them being some of them being onboarding partners, but we won't get into that terminology now. It's really important to recognize that there are a lot of medium and smaller companies who don't have the size and scale, and it is much harder for them to standardize across multiple markets. They don't have the affiliates, they don't have the international capability necessarily, and they don't have the scale to be able to support that. And I think that's where third parties can come in and help. So it could be third-party providers, it could be service providers who can actually help them do that. It all comes down to also to people, process, and tools.
Definitely.
Yeah, and I think and maybe a good metric, as I know we'll start to kind of close out these discussions. Maybe a good metric for those out there listening to kind of think through and consider more, and likely something that we can even dive deeper into in a future episode. Which is, if you're an organization that again that will have or does have responsibility for meeting multiple global serialization regulations, with the likelihood that you're going to only continue, right, to add more and more markets as you further distribute your product, and thus have to further meet more and more market requirements for serialization. I think one of the fascinating metrics that I always try to get some feedback from my clients on is, the expectation, in my opinion, right? My expectation would be that each time I go to comply with the next global regulation that I need to comply with, I should see some level of cost reduction in what it takes me to comply with that regulation, right? Meaning if it costs me, you know, 3x to comply with my first regulation, right? And then maybe my second regulation was I able to comply with that for only 2x the cost. And then for the third regulation, was I able to comply with that for 1x the cost, right? I mean, the expectation should be from an organizational standpoint that as you comply with more regulations, you're building learnings and you're sort of broadening your foundation of capabilities so that when that new regulation comes along, the hope is that it largely fits within, the capabilities and the foundation you've already built out as part of needing to comply with all of these other regulations. Right now, there's always going to be very specific, unique details about any given regulation, like how you might have to report data to a particular system for that market, right? Those are things that we still see happen all the time. Although it is kind of nice to see a number of markets, I'll say, moving towards more standardized use of like EPCIS as their reporting format to their national systems. But I think, again, more broadly, it's an interesting metric, I think, for a lot of companies to consider is, are you able to see sort of that reduction in cost every time you need to go out and comply with the next market that you have to comply with? Because I think if you are seeing that kind of reduction in cost, that's a good signal that you have a good foundation and sort of serialization capability. If what you're noticing is that it costs you just as much every time you need to go out and comply with a new market, there's probably some foundational reasons why that's happening, right? And certainly probably some foundational things that you'd want to look at within your capability. So that's kind of the leaving note that I would propose.
I think I'd agree with that. I think as you're rolling out to more markets and you're getting you should be seeing the operational efficiency and the maturity of the capability across your organization coming through, and that should lead to reductions in the cost to actually to comply with more regulations that come on board. And so the overall cost should come down. I do agree with you on that point, Scott.
Yeah, I would agree with that also. And thanks, Jerome, and thanks, Scott, for sharing your views and setting the tone to end our first session. I mean, I agree with what you said as well, Jerome, that it's really about maturity, not just ticking a box for systems or compliance. It's about how organizations adapt and grow to scale across markets. For me, the key takeaway today is that serialization should get easier and smarter. Costs should not rise with every new market or partner. They should return increased value and benefit as your capabilities mature. I mean, it really comes back to the principles or three of the four pillars: the right people, the right processes, the right tools, all working in sync. I mean, from alerts and scanner configurations to exceptions and regional quirks, there's much more for us to explore in future episodes, and we'll be diving deeper into these topics for sure. If you found today's episode useful, please follow the podcast, share it, and feel free to drop us a comment or question. Thanks again to my co-hosts, Jerome Bertin and Scott Pugh, and thank you all for listening. Catch you next time on Decommissioned, the Serialization Podcast. Goodbye.